Hi, how are you today?
Good. How are you, Andrew?
I'm doing well. So could you just please introduce yourself a little bit? Your name, sort of your title, a little short bio about yourself, your credentials, and then the hospital and team you're a part of.
Sure. So my name is Valarie Seccia. I'm the nurse manager of the medical ICU in Center City at Thomas Jefferson University Hospital. It's a 17-bed MICU. I have been with Jefferson since 2011. I have been with the MICU since 2014. I was a bedside nurse here, went into unit leadership as a bedside nurse, and then here we are several years later, and I am now the manager of the unit.
That sounds awesome. So why did you decide to submit your team for the All Pro Nursing Team Award?
Actually, this was a surprise to me. One of our comrades, his name is Dr. David DeCanny. He is our Magnet Program Specialist, read through our Magnet story, and nominated us for this award.
That's super exciting. So can you just tell me a little bit about the MICU dairy program that you guys submitted under?
Absolutely. So the diary program stemmed from our post ICU clinic. The post ICU clinic started in 2018 as a part of the Thrive initiative through the Society of Critical Care Medicine. The idea was to kind of create an environment of healing for our survivors. Our survivors, ICU survivors, are unique. They suffer from post-intensive care syndrome, which is it's multi-pronged. It deals with insomnia, depression, anxiety, and PTSD. And often these patients, or these survivors, I should say, will have other issues beyond their hospitalization. So this clinic, living our mission here at Jefferson, further improves their lives by seeing them outside of the hospital and following up on care that they really do need and is more difficult for, say, a primary care physician to handle. The diary
So,
program. I'm sorry.
no, you can continue.
So the diary program stemmed from that. I started seeing patients in that outpatient setting, and their stories were so incredible and so passionate to me. And I kept thinking, how can we help them more? There has to be something more for them. Often they didn't remember what happened to them, or they would have an altered perception of what happened to them. So research had shown that bridging the gap in memory loss is a way to kind of help combat some of the post-intensive care syndrome symptoms that these patients have. So we implemented this diary program to bridge the gap in memory loss. It was interprofessional. So we not only utilized nurses and even family members, but we utilized our physicians, we utilized pastoral care, speech, physical therapy, occupational therapy, and even our pharmacists. And really it was about creating a segue to the environment that they were in. So it was a lot about sights and sounds. You opened your eyes today. When I touched you, we traveled. Sometimes the ventilator can sound like a train horn when it goes off. Other things that would go in there, especially for families, would be something in terms of, it was, Sammy's 11th birthday this weekend. We celebrated at Chuck E. Cheese. Things like that. So when they were in recovery, they could learn about what happened not only to them in the hospital, but around them in within their families, to help bridge that gap and what they missed out on.
It sounds like you guys are doing some really important things to get these people back to where they were pre-injury or situation that put them in there. So with that in mind, so obviously this, how new is this you're working on?
Yeah, so the outpatient clinic started in 2018, and the diary program, after our IRB approval, all that stuff, actually started in COVID.
Oh, wow.
Yeah, so it started September of 2020. And it was very interesting because these patients were unlike any patients we had ever seen before. But we did find, seeing them in the clinic after their hospitalization stay and bringing their diaries with them, they really did value having and gaining some perspective about what happened. And it was meaningful really for the families as well who couldn't be with them. So it found that it was very patient-centered and family-centered. And in doing that, we recognized that should be a way for these survivors to communicate with one another. So we then, in 2022, I believe, was our first peer support group, which we hold quarterly, where our survivors can come together. Some nurses come on and they share their experiences together as well.
Super interesting. So given that it's a relatively new program, considering all programs that have gone on in medical history, what do you see the future of this being for your team, and not even just your team, but throughout all of the medical world?
Yeah, I really think it does bridge and close a gap that we have after hospitalization. In speaking for the nurses, I will say that, as an ICU nurse, you don't know what happens to them after they leave the ICU. They are often not the same person that their family talks about, even when they're discharged from here. So in seeing this afterwards and going to these clinics, seeing them as a human being, I think it really invigorates the staff to know the importance of what they do, keeping the sedation at a certain time, even speaking to them in a certain way so that they know that they're safe. And in terms of improving the patients, I mean, this is really something that is what Jefferson's mission is all about, is improving lives, because these people are so affected. And one of our patients, in fact, he's been with us since the pandemic and goes religiously to our peer support groups. It is amazing the different phases that he is going through, and that when new people come into the group, he can offer his experience to them and what had helped him move along as well. So I think in general, it really does help build these people back up and these survivors back up to hopefully get to a point of acceptance of who they were and who they are now.
That's awesome. So is there anything else that you want to talk about with the program? Any other information that you want to get out there for people to learn about, or anything that you just want to get out there in general?
About the diary program, I think I said everything. I think
Awesome.
I will say the peer support group is absolutely fantastic. The patients love it, they crave it, and I can't even tell you that it's almost like, especially during COVID, we felt isolated too as nurses, and patients often very much feel isolated in an ICU. So there is a shared experience there, which I think is absolutely incredible to have that connection between the patient and the nurses. It builds morale here, believe it or not. It's often sad in the ICU, so to get to see a happy ending really does make a difference.
Well, that's awesome. I'm glad that you're impacting so many lives in such a positive way. I think that's a really great thing that you guys are doing.
Thank you, and I really can't say enough about the team that we have here. It is really, it takes a village. It is not just one person, it is the entire group. It's a passionate group of nurses, physicians. We have dedicated physical therapists, occupational therapists, pharmacists. Everybody is just so fantastic and dedicated to this program. So it really is very, very, very impactful.
Well, that's great. Well, thank you so much for your time. I really appreciate it. And good luck to you and your team in the future.
Great. Thank you so much, Andrew.